Good morning, I'm Dr Kerry Chant from New South Wales Health with the COVID update for Sunday the 17th of October. There were 301 locally acquired cases of COVID reported in New South Wales in the 24 hours to 8 p.m. last night, and more than 69,000 COVID tests were reported during that period. It is essential that we keep that testing rate very high, so anyone with COVID symptoms, please go and get a test. New South Wales has reached the 80% double vaccine dose vaccination milestone. And can I thank everyone in the community who's come forward to protect themselves and protect the broader community. In the 12 to 15-year-old age group, 74% have had their first dose and 32% are fully vaccinated. We currently have 619 cases admitted to hospital and 137 people in intensive care, 71 of whom require ventilation. Of those in ICU, so of the 137 people in intensive care, 105 of those were not vaccinated. The vaccines are highly effective, so again, please get vaccinated. Sadly, New South Wales Health today is announcing the deaths of 10 people, 5 women and 5 men. 2 people were in their 50s, 2 people were in their 60s, 2 people were in their 70s, 3 people were in their 80s, and 1 person was in their 90s. 3 people were from southwestern Sydney, 2 people were from southern Sydney, 2 people were from southeastern Sydney, 1 person was from the Central Coast, 1 person from Newcastle area, and 1 person from the Cessnock area. 5 of the people were not vaccinated. 1 person had received 1 dose of the COVID vaccine, and 4 people had received 2 doses of the COVID vaccine. A woman in her 80s from southwestern Sydney died at Liverpool Hospital, where she had acquired her infection, and a man in his 80s from southeastern Sydney died at Prince of Wales Hospital, where he acquired his infection. And a man in his 90s died at Prince of Wales Hospital, and he was a resident of the Southern Cross Care Daceyville Aged Care Facility, where he acquired his infection. Can I pass on my sincere condolences to the families of those who have lost loved ones. In terms of the sewage surveillance program, we've detected fragments of the virus that cause COVID from Armidale and Wagulga. These areas have no known cases, so again a call out to those communities to be very vigilant for symptoms and come forward for testing. With school returning tomorrow, we've got kindergarten, year 1 and year 12 students going back. So remember, children can often experience very mild COVID symptoms. So please be on the lookout for those symptoms, and if they have the most minimal of symptoms, keep them home from school and get them tested. It's very pleasing to see those high rates of vaccine coverage, but we can strive to be the most highly vaccinated country in the world. So please again, reach out to those family members, friends, who may need extra assistance to get vaccinated. They may need assistance with making a booking, or they may need assistance with transport. There's a variety of options about how they can access vaccination, but please reach out. We do not want to leave anyone behind that wants a vaccine. Also, it is important as we transition to living with COVID that we still need to go about our daily lives taking COVID safe practices. It's important that we don't go out when we're sick. Instead, we need to get tested. We need to keep that physical distancing, particularly in indoor settings. And we also need to wear a mask where that's required. These simple measures will protect yourself, but will also protect the most vulnerable in the community. I would also finally like to say thank you to all those parents and all those children aged 12 to 15. What a stellar pickup of vaccination in that age group. However, I think we can also achieve 95% vaccine coverage in that age group. So I really urge you again, if you've got a child that's aged between 12 to 15, please assist them to get vaccinated. It's going to be critical as we move forward. Thank you very much again to the community for all you are doing to keep yourself and your loved ones and the broader community safe.